Is rising among younger women. According to a recent study in the Journal of American Medical Association, more people under the age of 50 are getting cancer. Dr. Whitney Young is joining us live today with what could be behind this increase. She's a breast cancer surgeon with the Hartford Healthcare Institute in Meriden and in Hamden. Welcome, doctor.
Thank you for having me.
So why do you think this trend is that more younger people are being diagnosed with breast cancer?
Environmental and lifestyle factors are linked to risk of cancer. These include things like diet, exercise, being overweight or obese, and use of alcohol or tobacco products. So we're seeing an increased incidence in cancers in younger patients.
And this is so important for women to know. You want to make those mammogram appointments, and the FDA's guidelines to get mammograms were recently changed. So what are the new guidelines?
The FDA recently released new guidelines for screening women with breast cancer at the national level. These guidelines now require mammogram providers to notify women if they have dense breast tissue on their mammogram and recommend a consultation with their doctor to determine if additional imaging is needed for breast cancer screening.
And do you think the adjustment will help diagnose women sooner?
Yes, being aware of having dense breast tissue and advocating for supplemental screening tests will allow patients, women, to partner with their doctors to allow detection of cancers earlier. Supplemental imaging like ultrasound and even other studies can be valuable tools alongside the annual mammogram to detect cancers that are difficult to see by mammogram alone.
Now, when it comes to family history, we know that's important. We hear a lot about our mother's history. What about on the father's side if there's a history of breast cancer?
Well, it's been misleading to rely solely on the maternal history. Family history of breast or other hereditary cancer syndromes can be passed along either maternal or paternal lineage. And we receive half of our genetic code from our mother and the other half from our father. So all family history is really taken into account when conducting a personalized risk assessment.
So lastly, I mean, we know genetic testing could be done, but when should someone actually consider that?
Women with a family history of breast cancer or other patterns of hereditary cancer syndromes within their family can consider genetic testing. Often we look at this around the age of 25 or 10 years earlier than the first cancer in the family. And that's a good time for a woman to meet with her provider to undergo sort of a personalized risk assessment and personalized planning for future screening.
Such good information. I hope everyone will make those appointments and make sure we get our screenings. Thank you so much, doctor, for being with us.
Thank you for having me.
For more information, please visit hartfordhealthcare.org/cancer.